Welcome to the Mariah Jean Fit YouTube channel. I'm Coach Mariah. Make sure you like our videos, subscribe to our channel, and share our videos as much as possible so we can reach a broader audience. We appreciate your support and enjoy the video. Hello and welcome to another vlog on YouTube and podcast on Spotify by the Fit Minds podcast. Coach Mariah here. Today I'm going to talk about the effects of low and high testosterone, specifically on males, but sometimes also on females. I'm going to talk about the effects it may have on a male or female's quality of life, sports performance, and overall health and well-being. One thing I will say before starting this podcast is that I'm very happy to see practitioners are currently discussing the effects of male and female specific issues that we're currently facing in the fitness industry and obviously for the general population. I strongly praise the male coaches that are paying attention to and addressing the topics of a female cycle from an informed perspective. I do see a lot of women discussing this topic in the industry, but obviously the male coaches I see doing this, they have female clients and it is very applicable in their space. And in reverse, for women, I do encourage the female coaches of the industry to educate themselves and certainly present some more diverse topics on testosterone because it's certainly something that's not really discussed at length. It obviously takes quite a lot of confidence and bravery to discuss a topic that may not necessarily be something with our own experience that we have, had from our own perspective or within our own lifestyle as coaches, but doesn't mean we can't talk about it and certainly create awareness around it. As a female coach, I'm aiming to address some of the basic hormonal issues for men, just as I would address issues for women, as it seems to be a topic that is not often discussed. And certainly in the light of issues such as REDS, low energy availability, and metabolic syndrome on the other end of the scale, risk of stroke, diabetes, and heart failure. We are progressively seeing a concerning rise in male deaths and illnesses associated and connected closely with these conditions. And obviously with huge prevalent troubles faced for mental health struggles and societal issues such as anxiety, depression, domestic violence, and male suicide. So this is all going to be very relative to the topic of high and low testosterone because of the symptoms that a male may experience and certainly then the onslaught and the after effect of that. Obviously, for both men and women, we have specific hormones and the effects of such, are topics that we definitely can and should address, right? Applying all of our evidence-based education and standard practice, as well as practical experience with our own clients. So it is a topic that I think that needs to be addressed and that should not be ignored. For the purpose of this particular topic and intended approach, I'm going to focus mostly on the effects of low testosterone, on the male athlete or the general population male client, because the effects of high testosterone are generally going to be seen more in the instances of use of exogenous hormones, especially in men. There are obviously going to be conditions specifically for women that may see the rise in high testosterone. So firstly, I will start with special mention to the idea that low testosterone levels can be exacerbated or influenced by a number of factors, including genetic predisposition, age, lifestyle factors such as smoking or excessive alcohol consumption, abuse of exogenous hormones such as steroids, low energy availability, stress levels, certain medications such as chemotherapy, sleep quality and length, micronutrient deficiencies, chronic disease or conditions, and of course exercise and dietary considerations. And in fact, low testosterone levels can be attributed to any number or combination of these risk factors. I will talk a little bit more about these and obviously the cause and effect, but certainly it is to be understood that it's not always a simple case of being one or the other of a cause of low testosterone, and it could be literally one of or many of the issues that you are facing. For both men and women, there are specific ranges of testosterone levels that are deemed to be within normal range of each individual person. Some men or women may sit at the lower end of the range and some sit at the higher end or just above. And perhaps this may not be a consideration that you might have taken, or perhaps your partner's friends or colleagues or relatives would have taken to understand the state of their overall health. So it's often missed. Testosterone, thinking about testosterone levels, even hormonal levels, is something that I don't think the everyday person is really considering. When we do find out we have hormonal imbalances, a lot of people fall back on that and kind of think that that's something that they are stuck with, but the matter of the fact is that we can influence our hormonal profiles with lots of different strategies and protocol to improve the state of the hormonal profile itself, and then obviously the symptoms that you are experiencing and your quality of life. So, for both men and women, testosterone is an essential hormone for overall health. For women, its role is increasing or enhancing libido, obviously, producing new blood cells, specifically more so for men though, contributing to the health of bones, breasts, fertility, menstruation, and vaginal health in women. So I bet you didn't realize that we actually have smaller amounts of testosterone, and these can actually stimulate other hormones, which then allow for our menstrual cycle to occur and obviously contribute to our fertility. For men, it's literally the major hormone, the backbone that influences their fertility, sex drive, quality of life, energy levels, muscle growth and strength, bone density, body fat distribution, body and facial hair, moods, and sports performance. So obviously, because we see testosterone in higher levels in men, it is pretty much the differentiation between men and women, obviously other than their anatomy, right? And obviously the other genetic factors, but the higher levels of testosterone allow a male to be having those male attributes and qualities. So there are specialists called endocrinologists who specifically specialize in hormones and the function thereof. I have to make special mention to endocrinologists because I am not one, okay? I am a sports nutritionist who has kind of like the basic education in hormonal function, and you would be seeing an endocrinologist for the more complex issues that might arise. So endocrinologists do not just specialize in sexual hormones, but they actually specialize in expertise in hormonal profiles, including our adrenal function, our insulin and hunger hormone function, and even the production of happy hormones, stress hormones, but certainly increasing happy hormones such as serotonin, oxytocin, and dopamine production. Sometimes if you have a more complex hormonal issue, as I mentioned, you may be required to book into or be referred onward to an endocrinologist. Most of the time, if you need to see a specialist, your GP should be referring you onwards, especially if you have a specific issue that your GP is not able to resolve. Generally, there will be a specialist that basically deals with that type of issue, and it would be seen that they need to pick the appropriate practitioner for you to refer you onwards. So, how many of you listening to this podcast can say with conviction that you have recently had full bloods tested in the past year, as it is recommended to have a full blood profile test performed at least once every year? Okay, and I can say it's going to be a pretty small percentage of you because, well, we just don't do it. We avoid the doctors like the plague. So, before I even dive any further into this podcast, if you haven't booked in a full blood test covering all hormonal profiles and potential nutrient deficiencies in the last year, I think it's about time that you book in with your doctor and arrange this. Even if you believe that you don't have any sort of underlying issues or conditions, sometimes we can simply dismiss persistent feelings of tiredness, feelings of sadness, irritability, unexplained pain, nausea, or lightheadedness as an inconvenience rather than a red flag our body may be telling us, waving around to say that something is wrong, okay? So now I'm going to cover the signs or symptoms of low testosterone in men and women. I apologize if I'm talking a little bit fast. This is a big topic to get through and I don't want to miss too much, but certainly I'm just going to try and cover as much as possible in the broader spectrum of things. So I'm going to discuss the signs and or symptoms of high testosterone respectively, along with the low testosterone, because I need to do that obviously. I can't just talk about low test. Sometimes the symptoms of low testosterone can overlap with the symptoms of other potential underlying conditions or issues. So, you can experience lethargy and not necessarily always have low test. You could have maybe a deficiency in some other micronutrient. So it's really important not to just believe that you have low test based on these symptoms alone. Don't Dr. Google yourself, which makes it obviously very difficult to conclude that the person would have low testosterone unless you had your bloods performed. So just make sure that you don't conclude that you think you have low test unless you actually go and get it tested. It's very important we do not simply generalize and self-diagnose without actually taking action for further investigation. Okay, we have to have proof before we start making these claims. Symptoms of low testosterone in men may include the following: hair loss, difficulty regulating body temperature, erectile dysfunction, reduced bone mass, reduced sex drive, reduced size of testicles, lethargy or fatigue, reduced strength, weight gain, trouble sleeping, mood changes, less facial hair growth, anxiety and depression, and there's probably a few more. So, doesn't sound very nice, okay? Symptoms of high testosterone can mostly be seen in males taking exogenous hormones, and by that I mean steroid use, okay, very loosely named. Rarely is this something that occurs naturally, so we don't usually see higher testosterone levels beyond range. For men, sometimes there are those rare cases where you might have somebody who has that genetic predisposition, and in which case there are options that they can take, but again, it's a very small percentage. It's usually through purposeful exogenous hormone supplementation. However, they can also present with some of the symptoms of low test or high estrogen whilst taking these exogenous substances, which may be cause for concern that the cycle is not being administered or dosed correctly. So this is probably one of the most common things that I see personally in the fitness industry with use of steroids, is that men are just not administering them correctly, they're not dosing them correctly, and they're kind of just taking their advice from their gym buddy, which is very, very, very dangerous. So I will talk a little bit further about this later on, but sometimes instead of experiencing the symptoms of high levels of testosterone that you might when you do start taking exogenous hormones, they may actually start experiencing the symptoms of low testosterone even whilst taking this synthetic hormone, and that can be because of other issues that can arise, such as higher levels of estrogen and complications which can occur when you are not dosing correctly, and certainly not taking other types of medications that you would need to take to counteract that. So, side effects or symptoms of steroid use or abuse can present with the following issues. These may be considered as the wanted or unwanted side effects. Okay, I'm not going to talk from a perspective of bias. Experienced by some of those usage of exogenous hormones. On the higher end of testosterone, for the sake of this podcast, however, this would look like, okay, increased sex drive, decreased testicle size, reduction in sperm production or count, erectile dysfunction. So yes, you can experience this all when you have high levels of testosterone or you're taking exogenous hormones. Mood changes, body or facial acne, increased body temperature and excessive sweating, excess or fast-tracked hair growth and even excessive or fast-tracked hair loss, paranoid thoughts or delusions, improved fat burning capabilities. See how I've got a mix of the positives and negatives, what you would be considered to be so. Improved sports performance, sure, increased strength and muscle mass, aggressive or risk-taking behaviors. It's a common misconception though that I think that steroids make a person aggressive. Usually they kind of have that background anyway, or they may have the pre-existing personality trait. This is a very general type of discussion around this topic, and I'm sure there's plenty of podcasts out there about this, but certainly that with the increase of testosterone, there is definitely evidence to support that there is an increase in aggressive or risk-taking behaviors. It doesn't necessarily mean they become violent, and that's just like, you flick a switch, but certainly they have seen that in studies that there is just that small increase, and it's because testosterone is obviously a rather strong hormone to be dealing with. Headaches, high blood pressure, heart or liver problems or failure, okay? So you can see that's a massive list of side effects. Obviously some are kind of positive, some could be considered negative or positive in some instances, but these are the risks that you see that come with exogenous hormone use. This is specifically in the case of males, but this is obviously what it looks like, and possibly something that is not really spoken about in the fitness community, because you see people kind of very strongly in favor or very strongly against, but the ones that aren't against aren't really discussing why they're against the use of these synthetic hormones, and the ones that are for aren't really discussing the risks either. There are definitely some YouTubers out there that discuss the risks of using synthetic hormones, and I really do take my hat off to those people because they're very transparent. Okay, so it's no coincidence that some of the symptoms of low natural testosterone in males may overlap with some of the side effects of using larger amounts of exogenous hormones, synthetic test. It's like, hold on, they're using a synthetic test, but then they're getting some symptoms of low testosterone whilst using it. That's really interesting. So, as there are numerous compounds with differing sides, okay? So it's not just straight test, there's lots of different things that you can take, and obviously they do have different side effects. And different amounts can obviously cause different types of reactions and symptoms in different people. But for the most part, use of these synthetic hormones in larger doses actually suppresses a male's natural production of testosterone. It's really important to understand this. It doesn't increase your own natural production, it just introduces a synthetic testosterone, and your own natural production is mostly suppressed. At least temporarily, in most cases, obviously, but in some cases, we don't actually know how many because there's just not enough studies on this, of irresponsible use, you can see more of a permanent effect. So basically, if you use exogenous hormones, there's no sort of rough guideline of exactly how long for as to when this happens, but you can see a permanent impact on your testosterone levels for the rest of your life, and that's your natural testosterone levels. So this is why it is crucial, as I mentioned, to ensure that if you are engaging in the use of exogenous and illicit hormones, that you are hiring the help of a well-versed professional in their field, okay? That's not me. I'm not a person who administers or even gives advice with exogenous hormones. I think it's playing with fire in my personal opinion, and I like to work with natural athletes myself, but the risks associated with following a dodgy cycle or even misadministering doses can be of great detriment to your quality of life, your health, and have potential serious long-term effects. If in doubt, ask around within the fitness community, okay? And someone will generally be able to refer you onwards to a coach that you can pay. So important that I say this, that you pay for their protocol advice, okay? Because it's so individualistic from person to person, and you should not be asking for free advice on how to administer synthetic hormones. It's actually just as insulting as asking for free nutritional advice. However, it must be considered that the risks involved with steroid use and the cost of involved may be not worth doing so, okay? It's very expensive. Costs a lot to do it properly as well. As a professional, I strongly recommend against the use of PEDs for younger men, okay, because you are still developing, all the way up until your late 30s, you're still developing. Even into your early 30s, it can be quite risky because this is when your natural testosterone levels are nice and high anyway. So there really should be no some sort of major need for high manipulation of testosterone around those ages. And it certainly can really make an impact to your own natural testosterone production around those early years, when it is actually crucial that you become pretty reliant on your own natural test, okay? So you don't want to make a big impact when you're younger and basically stuff yourself when you're older. I strongly recommend against PED use for women unless under the guidelines of a well-versed mentor, as I mentioned earlier, and with an understanding of all of the risks involved. It is a lot more scary with women, especially because we do see the issues with fertility, and certainly there can be literally that risk of becoming sterile, permanent hair growth, so there's lots of problems there, and obviously deepening of the voice. So I'll go into this a little bit later, but there's risks involved for women that, and certainly you're kind of playing around with these doses which can affect women on such small levels and have a really big impact on, especially from a perspective of side effects. So anyway, I'm moving on from there because I'm not going to talk too much about this. It's certainly a topic that I think that doesn't get covered by professionals who work in the natural field and in that part of the industry, but it is something that needs to be covered because, there are practitioners out there that do give advice. They can help you. I'm not one of them because I have a very strong moral and professional standpoint. So, symptoms of low testosterone in women. Okay, so I'd covered low test in men. I then went on to talk about high test in men specifically because it's going to be when you're using exogenous hormones. So you're not going to just get lucky and have really, really high test above range. Symptoms of low testosterone in women. Okay, so this one is really interesting because we don't often think about this. We think about testosterone in men, but we don't think about it for women. May include the following: lethargy or fatigue, reduced vaginal lubrication, difficulty reaching orgasm, reduced sex drive, thinning hair or hair loss, reduced bone density or bone mineral content, which can also induce increased risks of bone breaks and bone fractures and osteoporosis. Same with men as well. Okay, we can see increased risk of osteoporosis in men with low testosterone. Dry skin, reduced strength or muscle weakness, memory loss, weight gain, mood changes, including anxiety and depression. So you can see there how there are some really similar symptoms to what low testosterone would look like for males. But certainly you can see that in these cases where women are getting low testosterone, they may not even know that they have low testosterone, So generally we'll see more of this progressing through age in menopause. This is more prevalent, but certainly can be something that can appear a little bit earlier in life as well. So, symptoms of high testosterone in women, again, generally this is through exogenous hormone use, may include the following. These are all going to sound fairly familiar because we know that there is a stigma attached to exogenous hormone use, but this is just in excess, okay? This is when testosterone gets too high in women and we cannot process the remaining amount, and that's the free test, that's not, that we're not using. So, Increased strength is obviously one of the positive effects. You can see that that's why a lot of women would take exogenous hormones. Excess body hair, and I mean exogenous hormones in the way of specifically testosterone, so I'm not talking about estrogen, progesterone. Excess body hair, specifically facial hair. So we all hear about women growing beards when they take testosterone. Balding, acne, an enlarged clitoris, okay? Decreased breast size, deepening of the voice, increased muscle mass, and more defined jawline and masculine features, and increased fat loss. So you can kind of see that there's probably only really like three, you could probably have, say, improved performance as well. There's only really three major positive outcomes for that one, and the rest of them are quite high risk, but some of them aren't so bad. You're not going to get all of these symptoms. That's a thing that kind of used as a scare factor as well. I don't want to go in with that and say that, yes, the moment that somebody, a woman starts using testosterone, or certainly maybe their doctor has put them on a small dose of TRT, that they're going to get these symptoms. That's not true. There are safe amounts to use from a prescribed perspective, and certainly if it is prescribed as protocol from practitioners and health professionals in the sporting industry, in the bodybuilding industry, who know what they're doing. Okay, so however, at times outside of the exogenous hormone use, this may be attributed to by certain chronic health conditions such as hirsutism, I hope I said that right, polycystic ovary syndrome, and congenital adrenal hyperplasia. Okay, so these are all different conditions that can see that testosterone is a little bit abnormally higher than usual, and sometimes quite high. Or even tumours or growths on the pituitary, hypothalamus, or adrenal gland. And in some cases, excess body fat can spike the levels of free test in men. So it's, in women. So weirdly enough, higher body fat levels can see that women actually produce too much testosterone, and sometimes this can also if you think about it, when we see women who are higher body fat and they're struggling with things like PCOS, with the higher body fat percentages, you can see that the testosterone levels increase, and then obviously PCOS, may come after, PCOS may come before, but they definitely do go hand in hand. You won't see that everybody with PCOS is overweight or has a higher amount of body fat, but generally they can be connected with each other. So it's important to investigate all possibilities with your doctor or specialist before self-diagnosing. Okay, because you can't just say, well, look, I'm feeling like crap, I've got high test or I've got low test or whatever it might be as a female. It could be numerous factors. If you find out that you do have particularly high test and you're a female, you might be thinking, why is my test so high or why is my test so low? And there can be other conditions and issues related to this, which your practitioner should know that, they need to investigate. So generally, again, starting with bloods is a good place to start. So, causes of low testosterone in men may include the following. Very important to understand this, because this is pretty much what the podcast is about. It's understanding why. Why are we experiencing low testosterone with men? Why are they experiencing this? And basically, I'm going to move on to explain how we can improve it. So, lack of physical exercise, storing excess body fat for prolonged periods of time in excess of healthy body fat percentage ranges for men. So that's kind of 25 to 30% and above, okay? Below that is, or around that range, around the 25, 30% and below, can be considered healthy, but then when you start to kind of get below the 20% and roughly below the 15%, that's when you can start to see, again, some issues there. So it's almost like we kind of have to sit within this healthy range, neither too low in body fat nor high in body fat for both males and females, but above 25 to 30% is considered unhealthy for men. For women, it's actually between 30 and 40%. So as we start to get that 40% mark, we actually see that some of these negative health implications can apply. So obviously, this lack of physical exercise impacts male testosterone levels, the excess body fat, over-exercise, weirdly enough, okay? So I like to always address the opposing issue, which is, yes, over-exercise can actually decrease testosterone, and that's usually through overstimulation of adrenal function. So we basically see that we get adrenal fatigue, which is certainly that we have just too much stress basically applied to the body. Too much exercise stimulus, so double sessions or hours and hours training. If you're doing a gym session, then you're going for a big run every single day, lots of running, high activity sports. If you might be doing gym and then squash and then, gym and then soccer, and it's just, cumulatively, literally just dozens of, hours of exercise a week, that's where we start to see a real impact on your general health. So anywhere around that 2 to 3 hours of training, daily, inclusive of runs and things like that. So again, those moderate to high heart rate zones. And if you're then engaging in this exercise, 6 or 7 times a week, or if you're even doing double sessions, this is where we can see sometimes, yes, a negative impact on testosterone levels. So engaging in these types of activities daily without breaks, okay, without rest or days off from training, years training for 6 to 7 days a week, really fastidious and really neurotic training schedules, without taking 1 or 2 days off all exercise other than walks or low heart rate exercise at least weekly. So that's what you need to be doing to allow for recovery, or without taking a week off all high intensity or resistance-based exercises every few months for recovery. So I have seen quite commonly with men is that there are a lot of men who have, and women, who've trained for 10 years straight and haven't actually taken a week off training because they're so afraid of losing their gains or losing their muscle or losing their, cardiovascular fitness. And it actually takes a lot longer than a week to lose everything that you've worked hard for over the years. So another factor to consider is dieting for prolonged periods of time without sufficient prolonged breaks. Okay, so if the person has basically been in a calorie deficit for a long period of time. Insufficient carbs or energy for training, low energy availability in relation to the person's body fat percentage and lean body mass. So this is another major red flag that isn't being addressed enough with fitness professionals and nutritionists. And it basically sees, specifically for men, yes, for women as well, but you're not going to see as much of an issue with low testosterone because we have lower levels anyway naturally. This will impact men quite dramatically, and this is low energy availability, basically through dieting, or not even that. Sometimes they don't even know that they don't have enough energy availability. They may be, training really hard and they just might be going, yep, 3,000 calories is enough for me daily. And they might feel okay and they might think that's a lot of food, or they may just not even be aware of how many calories they're eating daily or how much food they're eating daily. And they might just be kind of blindly following their food, not necessarily purposefully dieting. And this is where a lot of men are basically underfeeding or certainly not giving themselves enough energy availability for the activity they're trying to perform. And this is in direct relation to their body fat percentage. If it's lower, right? So it says below that 25% mark, if you're sustaining it, certainly as well, and their lean body mass. So if they have higher muscle mass and they've obviously got that lower body fat percentage, there is a calculation that we use as professionals to figure out energy availability. And sometimes we see that in men that there is this, they can have low testosterone levels and they may have low energy availability. So it's a concept applied, as I mentioned, called EA, a literal calculation that we use, and it's something that I think that we are now using more now than ever. Through Sports Nutrition Australia, there's been so much evidence to support energy availability and certainly an improvement in sports performance and quality of life for men when we address this. But I'll talk a little bit more about the effects of low energy availability and the condition called REDS, which we're seeing more prevalence now than ever. So, over-consuming calories on the other end of the scale beyond total daily energy expenditure, resulting in excess fat gain. So you can really quickly see how we actually have to balance this. We have to balance not sustaining low body fat levels and low amounts of food for too long, and then we also have to balance that we're not kind of sustaining high body fat levels and excess of calories for too long either. So there's that happy medium, and it's no coincidence that it applies to energy in, energy out, and that's also a practice of balance as well. So, and it is all a science. So this is not some sort of, crazy theory. This is certainly backed by significant evidence, university-based studies, and it's making its way now into degrees that we are studying ourselves. So, over-consuming calories is probably, I think people think it's more common, but interestingly enough, we're now finding more cases and instances where underconsumption of calories for men is incredibly common. Lack of vitamin D is another reason that you can see low testosterone. So sunshine mostly, because that's where you get most of your vitamin D from, or even from your food. And in some cases, lower than required intake of dietary fats, which obviously were required to aid the absorption of vitamin D and other vitamins and minerals. Lack of dietary magnesium or zinc. is a big one as well. So these are very important for men and certainly for women. Zinc is incredibly important for men, and it's somewhat, I think, is ignored because unfortunately it's not very prevalent in the Western diet, including magnesium as well. And so that's where we can see issues. We also have issues absorbing magnesium and zinc. So we can actually sometimes think we're getting enough and not actually be getting enough. I'll talk a little bit more about this later on how to improve that. So another reason for, a cause for low testosterone or contributed to would be life stress. So if you're ticking some of these boxes, and if it's a few of them and you know you've got low test, it's probably going to point out exactly why, or part of the reason why. We shouldn't say exactly. So life stresses, we know we're all stressed, and men particularly, I think certainly with hustle culture as well, you know, men being pushed to grind further in their work, women are as well, but I think men, from what I've been told, certainly are being pushed harder than ever in their workplaces and certainly in family life, and life stress is something that kind of catches up with them very quickly. Adrenal fatigue. So as I mentioned earlier, that, you know, over-exercise, but even life stress can contribute to adrenal fatigue. Smoking or drinking, or drinking excessive amounts of alcohol. So this one, and both of these factors, no matter what anybody says, will reduce natural testosterone levels, unfortunately. So it's, you know, something we can't avoid. It's a fact. Natural process of aging certainly is the case for both men and women, so that can see a decline in natural testosterone. Doesn't always, especially in men, you see less of an impact of age on testosterone than the females, impact of aging on their hormonal profile. So some men can literally, you know, cruise on through to their 80s and 90s with plenty of testosterone and not have any issue at all. But there is a decline, you know, whether it's fast or slow, there is a decline. Excess levels of body fat, as I mentioned earlier, so through overconsumption of calories and not exercising, or certainly not using the calories that they're consuming, you know, through movement. Particularly low levels of body fat, as I mentioned earlier, for the lower energy availability factor there, okay? So, you know, sustaining that. And it's funny because you would think that having a six-pack would mean that you're healthy, but unfortunately that can then result in low testosterone levels if it is sustained for longer periods of time. And obviously it is reversible, you know, coming out of these situations where you have gotten really lean, you think, oh my God, my test levels are low, what do I do? We'll talk about that. Numerous medical conditions, which I won't go through because there's going to be quite a few of them, which may be causing issues with natural testosterone production. Prescription or chemotherapy drugs can also contribute to low testosterone. Tumors on the hypothalamus, pituitary, again, or adrenal glands, or testes. Okay, so it's an important one to remember. So I have had a case of a client, I won't say who because obviously it's important to, you know, keep that client confidentiality, but I had a case of a client who actually, you know, found out that they had osteoporosis. I'd asked whether or not maybe they'd been getting enough sunshine and asked them to get their testosterone levels checked, and surely enough, we found out that they had a tumor on their pituitary gland as a result. So interesting, but sometimes if you dig a little bit deeper beyond the issue that is at hand, you can really start to pick apart what might be occurring underneath. And this is what our job is, as certainly not to diagnose, because I'm not a GP, I'm not a surgeon, I'm not an endocrinologist. But if we do see signs of this, whether it be through things like pain, you know, if we've got clients who are training with us, they might have pain, they might have trouble in an exercise or something like that. They may be particularly tired. They may be telling us, hey, look, I've been really lethargic lately, etc., etc. It's actually our job to send them to their doctor, to get them to get their bloods, to investigate further beyond where we are currently, because it can save their life in some cases, and certainly give them an improvement in their quality of life. So, causes of low testosterone in women: stress, sleep deprivation, right? Weird, right? But it's, you know, it seems to be that these factors are going to be the cause of lots of problems, but there you go. Natural process of aging, again, as I mentioned, menopause, which obviously comes with age, but I would treat separately to the natural process of aging because it is aging in a sense, but it's not aging by itself. So obviously it's something that happens with time and certainly that needs to be treated. Menopause should be treated. Adrenal fatigue, as I mentioned earlier, so high levels of stress, and certainly if you are over-exercising at the same time and you've got other stimulus there as well. Genetic predispositions, you can have a genetic predisposition to low testosterone, absolutely. Deficiencies in what's called DHEA and DHEAS, being the precursor to testosterone, okay? So there are actually other precursors and enzymes required for the production of testosterone, and often we cannot be producing those. So just as vitamin D is essential for production of testosterone, you can see in women that particularly these precursors are very important, and you may have issues with those particular ones. Or even deficiencies in the specific enzymes that helps to produce the DHEA and DHEAS, okay? So it's kind of like, you know, this one comes first and then this one and then this one, and you might be missing this one, but you also might be missing this one, which is then, anyway, if you listen to the podcast, you'll be like, what is she doing? But sometimes we're missing a component that then contributes towards the domino effect of producing that hormone, okay? So it's not always directly that hormone that is the issue, and sometimes it's the ones that come, or the precursors and the enzymes that come beforehand. Surgery to the ovaries or conditions of the ovaries, okay? So again, this is all low testosterone causes in women. Smoking or drinking excessive amounts of alcohol, funny, it's also for men. Prescription or chemotherapy drugs, okay, so this is really sad because in some cases it can't be helped. You know, if you do have, you know, cancer, you've been diagnosed and you're on chemotherapy, unfortunately this can definitely suppress lots of different things in your system. Tumours on the hypothalamus, pituitary or adrenal glands, okay, so there are some overlapping causes there with men and women. All right, so I'm going to discuss two different topics now, obviously in relation to low testosterone. There's where we've got at one end of the scale for, this is specifically for men, it can be for women as well, because we're talking about testosterone and how we can see that being a part of these symptoms and these conditions. And these I like to focus on for men. But yes, there can be low testosterone levels for women who might be suffering with REDS and or metabolic syndrome. More so, you probably would see high test for metabolic syndrome for women because of those high body fat percentages, but basically test out of range, okay? So these conditions specifically. And REDS is being on the end of low energy availability, low body fat percentage, you know, over-exercising. So we're kind of at this extreme end. And then you've got obviously metabolic syndrome at the other extreme end. We have obesity, higher body fat percentages, and certainly underactivity. So again, that middle ground is that balance, okay? So REDS is an issue fairly prevalent but not spoken about as much as it probably should be within the fitness industry, and it's something that I really want to talk about a lot more. We are talking about it more so you know, in the field of Sports Nutrition Australia. We've been seeing a lot more published about it. However, now there is a shift towards understanding and recognizing an issue which previously was thought to only be specific to females. Okay, so how crazy that we thought that it was only something that applied mostly to females for such a long time until recently. So with further study, we actually have now found it is very prevalent in males, but it just presents very differently. It's a little bit more difficult to spot, okay? So what does it present as? You know, it has been a problem for quite some time, and it's proving examples in the cases such as MMA fighters, you know, reaching extreme conditioning and sustained lower body fats for some period of time, where we can see that there is, you know, and there can be official diagnosis of this issue and condition. This can induce the risk of heart failure through low energy availability. So that's probably the major risk of, you know, REDS. It's quite scary. You can die, okay? The signs are usually, but not always, paired with low testosterone, okay? Decreased energy and performance, and the relative symptoms of low testosterone, such as reduced libido and mood changes, okay? So a person who is over-exercising and under-eating and not even knowing it, or certainly maybe sustaining those lower body fat levels, and they may also be you know, not consuming enough calories and carbohydrates specifically, will be experiencing these symptoms of low testosterone, you know, in conjunction with this condition, this issue. So the biggest risk is obviously heart failure, right? And unfortunately, we've seen a large number of sporting athletes fall victim to this awful condition. You know, it's basically whereby they drop dead. It's not always the case where their heart failure is attributed to REDS. You know, it's not because it's not always REDS. It could be some underlying condition. But certainly we're seeing it being more prevalent with men now than ever, and in women as well. But when we're discovering these cases in men, it is in these cases where you've got, you know, athletes that are pushing themselves to the absolute extreme, and they do not have enough energy availability nor recovery to sustain that. So as practitioners, we need to do better and be able to spot the warning signs of REDS in men and women. We know what they are in women. It's just obviously very, very, very clear as day with women. But it's because they do not show the typical signs of someone who might have REDS. As a woman, with a lack of menstrual cycle, and men may still present with tangible signs which may be considered to be healthy from the outside. So we may be missing men with reds quite easily. They may be going, being swept under the carpet because they look healthy. They look like they've got a decent amount of muscle mass. They haven't got sort of any major atrophy or anything like that. They've got a six-pack, so we think they must be really healthy. And also another factor in this is that they may appear athletic, they may appear lean, they may be fit on paper. So this could throw off a health practitioner who has not been trained to spot the warning signs of such an issue, who has not been educated in the area, and because it is such a recent problem that we've seen with very recent studies in sports nutrition, it's something that will be missed by many. However, men are more inclined to disguise or over-exercise and undereat as a hustle mentality. So it's interesting, we think that eating disorders are more prevalent in women because it presents as things like anorexia and bulimia and absolutely very closely related to body image. It doesn't mean it doesn't exist with men, it just presents slightly differently, especially from a physiological and mental perspective. Okay, so we may not have the same telltale signs which would show and present reds in women as what you would see in men. So sometimes it can be disguised as I'm happy and I'm healthy and I'm doing great, and unfortunately they're quite tired, they're cooked, they're fatigued, and they're just not talking about it. So they're less likely to speak out about the side effects or struggles that they may be having with their own sports performance, quality of life, their career, and certainly things like loss of concentration, etc. Because they want to obviously keep their pride intact. I'm not a man, I don't know, but certainly from the discussions I've had, that is definitely a part of the problem. Probably because we've been men have been discouraged to do less or take a step back, right? So it's like it's almost like taking a break is not masculine or it's weak. You should be doing more because hustle culture has certainly taken over. To normalize recovery for men, we really need to ensure that this is a message we send out, that it's actually beneficial for their performance for them to recover and take time off, okay? This may unfortunately be a culture that we've encouraged for too long. We do see it with MMA fighters, we see it with all different types of sports, but certainly where people are having to make those specific weight categories and where they're having to perform at high levels in very extreme conditions. So, as I mentioned, obviously, fitness culture and extreme athletic endeavours can push men to the edge with this condition, and I'm actually looking forward to the years to come where people can identify this certainly more urgently. Metabolic syndrome. So I'm going to move on to the next, I suppose the other side of the extremes of where we would see low testosterone and the issues that we face with that, certainly in the overconsumption of calories and higher body fat for men. You do obviously see metabolic syndrome in women as well, but certainly for men, you're going to see this. It's going to be a little bit, I suppose, more prevalent with things like body fat stores around the tummy, and certainly something that I know that I've seen more in men myself, but yes, it is prevalent in women as well. This is generally an issue that we see to have, as I said, excess amounts of body fat, specifically stored around the stomach region. It has a massive increased risk of heart disease, high cholesterol, diabetes, stroke, and heart failure. So you can see that metabolic syndrome is kind of like this umbrella that is a collective for what could happen if you keep going the way you're going, basically, okay? And so there's all these risk factors that are in play here. Usually you would get diagnosed if you obviously have those higher body fat percentages. If you can see you've got particularly high visceral fats, organ fats, etc. But if those markers are above normal, where you've got higher cholesterol, where you have the kind of early onset of diabetes, where they are obviously having a look at your heart rate and the health of your heart, and then that's where we can see those issues with risk of stroke, heart failure, and the like. So usually the priority in this case is fairly simple. The treatment is fairly simple. As practitioners, I always like to have it, and legally we need a referral from a GP if somebody presents with metabolic syndrome. But the priority should be to reduce and maintain the body fat to healthy levels. Okay, reduce body fat and then maintain, which will dramatically reduce the risk of metabolic syndrome and the conditions developing later on in life, and obviously the symptoms of low testosterone that may come along with this. So this can be done through safely dieting by implementing a calorie deficit and introducing regular exercise long term, Once the desired body fat percentage and relative stored visceral fat, stomach fat, and obviously organ fat is reduced, the client can then return to maintenance level calories in hopes of maintaining their new lifestyle. You don't want to stop exercising altogether. That's not how it works. You would still continue exercising, but certainly there would be a less aggressive approach. So, how to naturally increase testosterone for men and women. I always leave the juicy parts for the end, okay? So if you're currently not exercising regularly, I mentioned this and addressed exercising regularly, anywhere from 3 to 5 times weekly of purposeful exercise, 30 minutes to 1 hour is recommended, okay? It would be seen, and that's per session, it would be seen that this would be something that you would need to introduce to your lifestyle. There is no particular preference for exercise type. However, there seems to be an increase in natural testosterone levels with the engagement of resistance-based training in the way of weights training or even resistance cardio endeavors, for example, so things like rowing or cycling, even increasing your daily steps if you're currently a sedentary worker. So if you sit down all day, the simple solution is to start moving a little bit more, whether it's just small walks here and there or getting off your bum and, doing just a little bit more daily to get your body a little bit more active. Reducing total calorie intake relative to energy output to create a calorie deficit and facilitate fat loss in conjunction with regular exercise. Only if you are sitting in those higher body fat percentage ranges. And you can only determine that if you then go and get, things like skin folds or an in-body scan to figure out where you're sitting. So while meeting a minimum protein requirement when you're in this calorie deficit, obviously for the purpose of muscle preservation and muscle protein synthesis, and muscle maintenance, ensuring your total dietary fat intake does not exceed 30% of your total daily intake, okay? So this is just general recommendations for nutrition anyway, but this is kind of where you'd want to be heading towards. And honestly, sometimes working with a professional to establish exactly the amount of calories you should be consuming at any given point in time, including things like diet breaks, etc., is possibly the way to go. Devising a plan for this to be implemented moving forward, that would be the best option. Just get someone to work with you on your goals and certainly to improve your body composition in the direction of, reducing body fat and increasing testosterone. That's if you've got high body fat levels, if you're not very active, and if you are over-consuming calories, okay? And if you have higher body fat levels, okay, you are most likely, you are over-consuming your calories on a daily basis to sustain that, or at least you're not moving enough to utilize the calories you're consuming to reduce body fat to a maintainable level. So, you can also increase your vitamin D intake through obviously exposing yourself to 15 to 20 minutes of direct sunlight exposure daily, slightly more for those with melanin, so more melanin in their skin. Increase magnesium and zinc intake specifically for males. So this may look like supplementing higher levels of magnesium and zinc because generally, as I mentioned, the Western diet does not include a lot of magnesium. I always encourage supplementing magnesium and zinc back in for women as well, okay? Because magnesium is great for muscle cramps and zinc is really fantastic for immune function. And obviously magnesium and zinc are great for bone health as well. So there's no coincidence I recommend supplementing them for men for low testosterone and certainly for women around the time of their cycle when they're due for their cycle. I did mention this in the previous cycle on Menzies. Increasing fruit and vegetables, okay, which I know you guys hate me for saying this every podcast. Increase your fruit and veggies, which contain the micronutrient profiles required for a balanced diet. And obviously then ensuring that we are getting, a diverse enough profile to cover all of the types of, and that's why they're called essential micronutrients, because without them, our body goes a little bit gaga. So, if you increase your fruit and veggies, it's not because I'm being an asshole. I'm telling you to do this to increase your quality of life as well. There is a reason why we need to eat fruit and veggies, because there is an after effect that affects everything from hormone production to energy levels to quality of your skin, your hair, etc. And bones. There are so many reasons why we need to eat fruit and veggies. And obviously whole foods as well, nuts, seeds, you name it, whole grains, the list goes on. Ensuring dietary fat intake is no lower than 20% of total daily intake. So this is important. No higher than 30, no lower than 20. Somewhere in the middle, practitioners, sometimes we like to use, depending on activity levels, we kind of gauge as to which way we want to go. So as you can see, there is a balance with that too, that dietary fat intake we need to have an idea of exactly how much we're eating. Too low in the amount of dietary intake, obviously can see that we may reduce absorption of other vitamins and minerals, which we require to then help us produce testosterone, specifically men. Introducing frequent exercise and implementing a calorie deficit would only apply, as I mentioned, to those who are sitting in particularly higher body fat percentages with lower muscle mass, okay? So for their frame, so that if they're, say for example, you haven't gone to the gym, we haven't exercised in years, it would be that you would probably need to make that type of change to help with your testosterone levels. And if you're living a fairly inactive lifestyle. So it only applies to that. If you're a person who currently exercises frequently and you're eating really well and you're like, oh, well, hold on, I'll just decrease my calories and, exercise more to increase my testosterone, please don't do that. Please don't do that. In the case of those who may be over-exercising, so this leads me to my next point. It might look like reducing I know it sounds so like, oh my God, that's the answer. Of course it is, because yes, practically yes, but unfortunately some people can't apply it because they get in their heads and they think that, they can't do what's required because of X, Y, Z. It might look like reducing your exercise frequency if you are training too much. Decreasing the duration and the intensity, okay? If you are sore all the time, if you are tired, if your eyes are burning, and you think, hold on, I think I'm doing everything right, I'm training so hard every single day, you're probably not eating enough food, your recovery is really shitty, you may not be sleeping enough, and you may just be overdoing it. And as men, unfortunately, this is something that's often neglected. Taking more frequent breaks and days off from training is really important. Perhaps even implementing a week of training, as I mentioned, every 8 to 12 weeks if you have not done this over a long period of time, okay? It takes a lot for me to encourage a client to do this and to have enough trust in me as their coach, but eventually we get to that point and sometimes it can be an incredible change for their life because in the cases where you see athletes who have been training for years and years and years on end without breaks, this can be very detrimental to their health. However, again, your energy availability calculation devised for you by a professional, should be the key factor in this is that you do need a nutritionist to do this up for you, to do this calculation and legally be able to provide that. Reducing overall stress levels. Easier said than done, but this could look like perhaps taking a little bit of a step back from that overcommitment and taking some life tasks or duties off your plate. So yes, reducing your adrenal fatigue and reducing your stress levels can actually help increase your natural test levels, specifically for men. Increasing sleep quality and duration. This may look like reducing your caffeine intake. I know, how terrible. But unfortunately, high amounts of caffeine can actually, yes, result in adrenal fatigue. How crazy. And also reliance upon caffeine for natural energy production. So when you take the caffeine away, your body does not know how to produce adrenaline. And you need that. You need that stuff. So possibly trying to consume caffeine no less than 8 hours before bedtime if possible. Okay, any type of caffeine. Reducing light or noise distractions during sleep because this can often cause broken sleep or certainly contribute to it. Having naps or sleeps in where you can on the weekends or days off and reducing the time on technology or late in the evenings. Okay, so this all points towards improving what's called sleep hygiene. Or perhaps establishing a bedtime routine and cut off time for sleep to reach that 7 to 9 hours ideally each night. Men do need a little bit less than women, but ideally if you have low testosterone levels, it actually can't hurt to get a little bit extra sleep to help with that as well. It's all part of that recovery process. So I'll finish off with how to synthetically increase testosterone and maybe some of the risks and perks involved. So prescription legal TRT can be given to either men or women. It can certainly drastically change your quality of life if you have already addressed all of the above and you think that you're ticking all the other boxes, okay? However, there can be, unfortunately, once started, a bit of a long-term reliance upon TRT because it then obviously changes your own natural profile and what your body gets used to producing. So there is that risk there, and obviously your doctor can talk to you about that. There are some side effects, as mentioned previously, with use of testosterone long-term, but obviously they're not going to be as prevalent when you have such small amounts because TRT is exactly that. It's not a lot of testosterone. It's not notable enough usually to experience side effects that are, going to reduce your quality of life. Decreased fertility can be one yucky side effect of TRT in both men or women. So unfortunately, this can be something that can impact people, and especially if you're trying to start a family, weirdly enough, TRT might not actually be the best option. However, it's not something I can say as a professional. You would need to consult your GP and figure out whether or not there's something that they can work around with that process, certainly to, see if you can or if you need to, come off it or whatever it looks like. But there are sides. There's always going to be side effects of taking synthetic hormones. So It can be a little bit expensive. I mean, technically, no, it's not that expensive, but it can be another added prescription on your list. If you are currently already taking a lot of medications, if you have a lot of things to pay for in a week and you just think to yourself, do you know what, I actually haven't addressed any of the issues where I might be experiencing low testosterone. I haven't actually had a look at that first. I haven't even been to an endocrinologist who might be able to help me naturally. And therefore, obviously, then you can get rid of that long-term cost, which you may be on for a longer period of time, depending on, whether or not you become a little bit more reliant on it. So it should be a last resort after attempting a prolonged period, with obviously the other changes noted and made, and certainly regular bloods to check up on the effects of your testosterone levels. To conclude, it is important to remain aware that testosterone and the importance of its role plays as a whole for both women and men. It is crucial in maintaining general health and well-being. If you believe that you have issues with hormone production or any sort of underlying conditions or symptoms that may be reducing your quality of life, it's important to consult a professional, your GP, or your specialist to further investigate, okay? If you have any questions at all, please do not hesitate to message me. I am going to be the first person to refer you onwards to the right person, which will most likely be your GP, so you can get a specialist appointment. But hopefully you took away some tips from this podcast, and there are some things that you can already implement to make those improvements in your life. Go get your bloods done, okay? Don't diagnose yourself. Get your bloods done, get a better idea of where you're sitting, and you never know, you might uncover some things that actually give you some insight into what you can do to change your lifestyle. That's it from me. I hope you have an amazing day, evening, or time of day wherever you are. I don't know. I suppose if you're listening overseas, it might not be daytime. It's now nighttime here. I hope you have a wonderful afternoon, evening, morning, wherever you are. And I'm looking forward to doing a vlog for you soon. Thanks a lot. Bye.